Good morning, ladies and gentlemen. Today's lecture is on a novel drug which is used in dermatology. This is a new thing, and it is nowadays quite popular here in Pakistan. So I delivered this lecture in the PadCon, and I think that I should deliver the lecture in my channel as well, because you may be asked about this drug in your Viva. And this also has a lot of clinical applications in dermatology and which you can use now in your clinics. So the drug is tofacitinib. Tofacitinib is a Janus kinase or JAK inhibitor, which was discovered and developed by National Institute of Health. Food and Drug Authority USA approved it in medical indications first in 2012. Tofacitinib is a small molecule, but it is not a biologic. Mechanism of action. Tofacitinib is an inhibitor of enzyme Janus kinase 1 and Janus kinase 3. It interfaces with JAK-STAT signaling pathway, which transmits extracellular information into the cell nucleus, hence influencing the DNA transcription. So once this effect is blocked, then many of the inflammatory effect of diseases are stopped and blocked. Medical uses. FDA approved tofacitinib in treatment of rheumatoid arthritis in adults in November 2012. This was the first approved indication of JAK inhibitor in medicine, especially those who have had inadequate response to or who were intolerant to methotrexate and can be used in combination with methotrexate. Then it was approved in May 2018 in the use of adult patients with moderately to severe ulcerative colitis. In 2021 and 22, results of phase 3 trials showed significant improvement in patients who were suffering from ankylosing spondylitis, the active disease. Then in 2018, FDA approved tofacitinib in treatment of ulcerative colitis. Well, the most interesting approval was for the use of tofacitinib in severe and critical COVID-19 patients. Now we are coming to our point of interest, that is the use of tofacitinib in dermatological conditions. First of all, tofacitinib in psoriasis. So I am mentioning few diseases, the outcome of few diseases and with their references. So one of the studies shows tofacitinib and other JAK inhibitors show potential to broaden the treatment options in psoriatic arthritis and other inflammatory conditions. In another study, there is marked upregulation of JAK-STAT pathways in psoriasis. This was their observation, and use of novel JAK-STAT inhibitor tofacitinib have been shown to have a reasonable efficacy in phase 2 and phase 3 trials. So this was 2015 when this drug was in initial phases of use in psoriasis. In 197 patients who were randomized, the primary endpoint was PASI score of 75 at 12 weeks. And the response rate was significantly higher for all tofacitinib twice daily groups. The response was 25% with 2 milligram BD dose, 40.8% in 5 milligram BD dose, and 66.7% in 15 milligram BD dose compared with placebo. So in Pakistan and most of the countries, tofacitinib is available in 5 milligram tablets, and usual prescribing dose is 5 milligram BD. Another study shows that a phase 2A study demonstrated that topical treatment with JAK inhibitor, tofacitinib, in an ointment formulation provides improvement in the clinical signs of psoriasis for patients with mild to moderate chronic plaque psoriasis. So the topical ointment of tofacitinib is not available in Pakistan, but I hope that soon some company will launch this product because this has quite a bit of promise in the treatment of mild to moderate chronic plaque psoriasis. Till now, we have only the vitamin D analogs for this purpose. Then, a role of tofacitinib in psoriatic arthritis. So the drug is good in the way that it is able to control both the signs and symptoms of chronic plaque psoriasis and psoriatic arthritis. So this study mentioned the two well-designed phase 3 trials, the OPAL Broaden and OPAL Beyond, with 5 milligram tofacitinib twice a day, which was co-administered with methotrexate or another approved conventional synthetic disease-modifying drug regimen. And it significantly improved psoriatic arthritis after 3 months of treatment, while also improving skin psoriasis, enthesitis, dactylitis, physical functions, and fatigue. So tofacitinib 5 milligram BD has an acceptable tolerability profile with low incidence of serious infections, malignancies, cardiovascular events, and GI perforation over 36 months. These are the usually feared complications of tofacitinib. So this is quite a recent study, 2019. Then another study from 2019 shows that tofacitinib provides an alternative option for patients who have had an inadequate response and tolerance to other disease-modifying anti-rheumatic drugs. It has demonstrated comparable efficacy to biologics, is effective in the management of treatment-resistant disease, and is reported to improve enthesitis, dactylitis, and radiographic progression. So as far as the price is concerned, it is much cheaper than biologics. Then a very useful indication of tofacitinib in alopecia areata, especially once we are dealing with alopecia totalis or universalis. This is a study from 2019, and it had a cohort of 20 patients of alopecia areata. Most of them were female. Patients were treated at average of 13 months, almost an year. And majority of patients took 20 milligram in a split daily dose. So the dose was high, that is 10 milligram twice a day. Average time to regrowth was 3.85 months. So almost 4 months later, the patient showed regrowth. Only 3 patients were non-responders. Among the 20 patients, 7 patients developed lab abnormalities. 4 patients had lipid abnormalities. 6 have clinical adverse effects, which include palpitation, herpes, zoster, and upper respiratory infection. But these effects did not make the patient stop the drug. This slide shows about 6 different studies. And the conclusion of all these studies was that the treatment duration was from 2 to 18 months in alopecia areata. The durability, however, was short, and shedding of hairs occurred about 8.5 weeks after the discontinuation of drug. Although this side effect is seen in most other drugs which are used in alopecia areata, like steroids, like cyclosporin or azathioprine. Less is known about the extended tofacitinib administration. So none of the studies gave tofacitinib for more than 1 year. Then use of tofacitinib in vitiligo. This is very important because in vitiligo, we don't have any other option except steroids. This is a little older study, 2015 Eczema, and this report was first to demonstrate the effective pathogenesis-based therapy in patients with vitiligo. Then comes 2017 study. And this study shows that in contrast to treatment with phototherapy alone, repigmentation during treatment with JAK inhibitor may require only low-level light. So the study showed that the JAK inhibitor will help the patients who are already on phototherapy. And the results support a model where JAK inhibitors suppress the T cell mediators of vitiligo. Then another study shows that the JAK inhibitors has explored as a promising novel treatment option in vitiligo. The mechanism is that it's useful because interferon gamma-dependent cytokines produced through this pathway have been implicated in pathogenesis of vitiligo. So JAK inhibitor would suppress this. And the research outlined here show JAK inhibitor in patients with vitiligo have favorable safety profile and effectively produce repigmentation, especially with concomitant ultraviolet exposure. So in most of my patients, I have given this along with phototherapy, and this is the best combination if you are dealing with a patient of extensive vitiligo. In another study, which is from 2020, the report details the cases of patients with rheumatoid arthritis associated with vitiligo, whose condition continuously improved during the 2 years of treatment with oral tofacitinib in a dose of 5 mg twice a day, even without the exposure of ultraviolet radiation. So the patient received tofacitinib for rheumatoid arthritis, and the patient was having vitiligo as well. And in addition to improvement in rheumatoid arthritis, the patient vitiligo improved, and this patient did not receive UVB therapy. Tofacitinib in atopic eczema. So this study is from 2015. 6 consecutive patients with moderate to severe atopic dermatitis had failed standard treatment were treated with tofacitinib. It decreases the body surface area involvement of dermatitis and decreased erythema, edema, papulation, lichenification, excoriation. So all the effects of atopic dermatitis were well controlled. In another study, which is very recent, 2022, shows significant improvement in symptoms were obtained by each drug, by drug with low frequency of adverse effect, and in particular, oral JAK inhibitors have the ability to improve pruritus and skin symptoms quickly. Therefore, the emergence of these topical and oral JAK inhibitors would regard as innovation in treatment of atopic dermatitis. So in this study, both the topical and the oral JAK inhibitors, tofacitinib, was used, and both were found useful. So the usual dose here is 5 mg twice a day in adults, and the tablet has to be taken orally with or without food. The adverse effects. The most common side effect of tofacitinib or other JAK inhibitors is headache and diarrhea. These are not severe side effects and should be managed without stopping the drug. The other effects include tiredness, dizziness, tachycardia, dyspnea, nausea, vomiting, loss of appetite, abdominal pain, and jaundice. There may be increased risk of pulmonary embolism. So these group of symptoms are also not very severe and may not require stopping the drug, but it is essential that the patient should be thoroughly investigated before putting him on tofacitinib. Serious allergic reactions are rare. So tofacitinib has a potential of causing serious infections that include tuberculosis, bacterial infections, invasive fungal infections, viral infections, and other opportunistic infections. The animal studies with tofacitinib conducted prior to the human trials showed some carcinogenesis, mutagenesis, and impairment of fertility. Precautions to be observed before prescribing tofacitinib. This slide is very important. Most of the patients in which I have prescribed this tofacitinib, they were young people. They were young people suffering from vitiligo, alopecia areata, or atopic eczema. So you don't have to be very, very stingy in these patients. But in older patients, you have to be very careful. But a thorough investigations before prescribing tofacitinib is must. So you must look for the coagulation disturbances, blood marrow disorders, malignancies, heart, renal, or liver diseases, heart, renal, intestinal, or liver diseases like hepatitis B or C, recent infections on any history of stroke or heart attack. Avoid immunization, vaccination during the treatment. During pregnancy, the medication should be used with caution. It's unknown if the medication passes in the breast milk. However, because of potential risk, it is not recommended to be used even in lactation. Older adults may have a greater risk of infections while using this drug. So, what would be the laboratory workup before prescribing tofacitinib? Blood complete picture to look for any abnormality in cell lines, in hemoglobin, in WBCs, and in platelets. Then liver function test, renal function test, coagulation profile like prothrombin time and PTTK, ASO titer to detect any streptococcal infections, MON2 or serum gold quantiferon to exclude tuberculosis, HIV and hepatitis B and C serology. If the patient is negative, then you can very well prescribe tofacitinib with confidence and without any risk of serious side effects. So, conclusion. Tofacitinib is a new addition in dermatology in Pakistan. The drug is found useful and well tolerated with less side effects as compared to other drugs that are used in psoriasis, psoriatic arthritis, atopic eczema, and alopecia areata. For vitiligo, it may be considered as the only systemic option with except of systemic steroids. Being a relatively new drug, careful monitoring is must while the patient is placed on the medicine. However, drug is relatively safe, so further monitoring is not much required. Treatment is to be advised for at least 3 months. Thank you all for patient listening and have a good day.